Hi, my name is Stephanie. I will be doing the inferior limb palpation today with my sister Yasmin as my model. So I'll do the room scan first and then we'll get started. Okay. Get a little sneak peek of my room. Hello. Okay, and then the clock is right there and my list as well. Cool. I'll get repositioned here. All right. So we'll start off with the bony lamb. Why am I feel like I'm like, it's crooked? Oh, I think it's fine. Okay, sorry, I'm messing with my eyes. Okay, we'll start with the bony landmarks. First one is the ASIS of the ilium. So that's going to be found on the anterior surface of her body. We can start, I'll just do it on this side, but start with the side of the abdomen lower than the level of the umbilicus. Sorry. And gently compress until I find the superficial tip of the ASIS of the ilium, which for her is right here. Now for the greater trochanter, that can be found on the most lateral prominence of the thigh. So I will kind of just gently glide my hand over the most prominent area and I will find a bump, and that bump is her greater trochanter. Now I'm going to take a seat. For the patella is easiest palpated when the knee is in a flexed position right now as she's seated. So it's, once again, the most prominent surface, which is here. The patella can be outlined by my fingers are doing right now. Now the medial condyle of the tibia can be helped by the patella. So now that we know the location of the patella, we can move 3 to 4 inches medially of the patella, and I would say probably an inch inferior, and that bony prominence is the medial, most superficial surface of the medial condyle of the tibia. Now for the head of the fibula, if you want to face that way for me so I can see the outside of your leg. The head of the fibula can be located by starting at the lateral malleolus, following the shaft of the fibula superiorly to about the level of the knee, and this bony prominence is the head of the fibula. Next, we'll do the muscles. So if you want to stand up and have your back towards the camera, great. We'll start with the iliopsoas group. Now this group consists of 2 muscles. One is the psoas major and the other is the iliacus. So for the psoas major, that's going to originate at the bodies and transverse processes of her lumbar spine. And the muscle fibers are going to move inferiorly to the lesser trochanter of the femur. The iliacus is going to originate from the iliac fossa, which cannot be palpated on the posterior side as it's on the anterior surface of the ilium. But it's going to originate again from the iliac fossa and move inferiorly to the also lesser trochanter of the femur. The actions are the same for both muscles, and with the exception for one that's specific to the psoas major. That one is to unilaterally assist in lateral flexion of the lumbar spine. The other actions include when the origin is fixed, to have flexion at the hip and may laterally rotate the hip. And then when the insertion is fixed, there's going to be flexion of the trunk towards the thigh and anterior pelvic tilt, which is just the pelvis tipping forward. So that's the iliopsoas group. Next is the bicep femoris. Bicep femoris is a hamstring muscle, so that's found on the posterior side of her body. It has 2 heads, hence bicep. So the long head is going to originate from the ischial tuberosity, which is the bony prominence that can be felt when seated. That's the long head, and the short head is going to originate from the lateral lip of the linea aspera, and both heads are going to insert to the head of the to the head of the fibula. Now, that muscle has a couple of actions. So the first two is going to be flexion of the knee and lateral rotation of the flexed knee. And the long head is responsible for 3 actions, which include extension of the hip, so just more obvious, extension of the hip, extension of the hip, lateral rotation of the hip, and posterior pelvic tilt. So it's the pelvis, sacrum going inferior and pelvis tipping forward and up. Great. Okay, now you want to turn around for me. Next we have the vastus medialis. Sorry, you turn back around. I just remembered that the origin is on the posterior side. So the vastus medialis is a quadricep muscle that runs on the anterior surface of the femur, but it's going to originate on the medial lip of the linea aspera of the femur. It's going to run medially across the thigh, if you want to turn back around for me. So medial thigh, inside the thigh, and then come across to insert at the tibial tuberosity, which is just inferior to the patella. Vastus medialis is responsible for one action, which is extension of the knee. Extension of the knee. All right, now the TFL, the tensor fascia latae, is on the lateral side of the thigh. So I'm gonna have you turn to your side, and you want to put your arms up for me so I can see the side of your leg. Perfect. The TFL is going to originate at the iliac crest. Now the iliac crest is just inferior to the ASIS, as palpated earlier, and it's going to insert to the iliotibial tract, also known as the IT band, which runs lateral of the thigh. The actions for the TFL include the TFL, medial rotation of the hip, abduction of the hip, and medial rotation, abduction, and flexion of the hip. Next is the tibialis anterior. You want to sit down for me? Good. Tibialis anterior is on the anterior surface of the lower leg. Excuse me. This muscle is going to originate from the lateral condyle of the tibia, the proximal lateral surface of the tibia, and the interosseous membrane, and it's going to insert to the medial calcaneus and run on the plantar surface across the foot to the lateral side, also inserting to the base of the 5th metatarsal. The actions for the tibialis anterior include inversion of the foot and dorsiflexion of the ankle. And that is all of the bony landmarks and muscles for the lower limb. Thank you.